Viral exanthems. Definition. Viral exanthems are caused by hematogenous dissemination of virus to the skin, in which a vascular response is elicited. The clinical appearance of a virus-induced generalized erythema is not specific to a given virus. Other signs and symptoms, however, may indicate a particular etiologic agent. The viruses that are most often associated with exanthems are Rubeola, measles, Rubella, German measles, herpesvirus type 6, Roseola, Parvovirus B19, Erythema infectiosum. And the enteroviruses, enteric cytopathic human orphan, ECHO, and Coxsackievirus. Viral infection with severe acute respiratory syndrome coronavirus 2 and the subsequent illness it causes, coronavirus disease 2019, COVID-19, can lead to a variety of cutaneous reactions, including a generalized morbilliform eruption. Major viruses producing exanthems. 1. Measles, Rubeola. 2. German measles, Rubella. 3. Herpesvirus type 6, Roseola. 4. Parvovirus B19, Erythema infectiosum. 5. Enteroviruses, ECHO and Coxsackievirus. Viral exanthema, symmetric red macules and papules. Incidence. Exanthem-producing viral infections rank high among the classic, common childhood diseases. Widespread immunization for rubella and rubeola has significantly reduced the incidence of these diseases. Vaccine hesitancy and misinformation, which worsened during the COVID-19 pandemic, have led to a fall in measles vaccination rates and subsequent outbreaks of this highly contagious virus. Viral exanthems occur in adults but much less often than in children. In children younger than 2 years, Roseola is the most common viral exanthem. Erythema infectiosum, fifth disease, occurs in young school-aged children, often in epidemics. Enteroviral infections are most common in the summer and fall. Physical examination. The generalized eruption is composed of erythematous macules and papules. In measles, rubeola, and German measles, the rash typically begins on the head, characteristically behind the ears in measles, and proceeds to involve the trunk and extremities. The macules and papules in rubella are discrete, even on the trunk, and have a cephalocaudal spread of exanthema, like measles. In Roseola, exanthem subitem or sixth disease. Rose-red macules and papules develop primarily on the trunk and proximal extremities. Erythema infectiosum characteristically begins with red cheeks that have a slapped appearance, followed by a reticulated, net-like, erythema on the trunk and proximal extremities. Erythema infectiosum. A. Characteristic, slapped cheeks. B. Reticulated, net-like, erythema on the upper arm. The rashes associated with enterovirus infections are most often rubella-like but occasionally purpuric. Vesicular eruptions also occur with some types of enterovirus infections, example, hand, foot, and mouth disease from Coxsackievirus A16 infection. Hand, foot, mouth disease. A. Erosion with fibrinous base on the tongue. B. Pustule with peripheral erythema oriented along skin lines on the palm. Mucous membranes are sometimes involved. In rubella, red spots occur on the soft palate. In measles, Koplik spots are characteristic and often precede the rash. Koplik spots are found on the buccal mucosa and appear as tiny gray-white papules on an erythematous base. In Roseola, erythematous macules develop on the soft palate 48 hours before the exanthem. Fever is almost always present. In patients with Roseola caused by human herpesvirus type 6, the fever characteristically subsides abruptly just before the rash appears. The rash lasts 24 to 48 hours and appears as discrete rose-red macules or maculopapules, similar to rubella and measles. Roseola. A. Discrete rose-red macules and papules on the face. B. Discrete rose-red macules and papules on the trunk of the same infant. In rubella, the most strikingly enlarged lymph nodes are found in the head and neck. In measles, lymphadenopathy is often generalized. Aseptic meningitis occasionally occurs in enterovirus infections. COVID-19 infection is most commonly associated with a morbilliform rash. Another unique cutaneous manifestation is COVID toes, which is theorized to be due to vascular injury and seen most commonly in children. COVID toes is similar in appearance to an uncommon skin condition called pernio. Symptoms tend to be mild, and the rash resolves in 2 to 8 weeks. COVID toes. Red-purple macules on the toes. Differential diagnosis. Drug rashes are usually pruritic and are redder and more confluent than viral exanthems. Toxic erythemas favor flexural folds, may feel like sandpaper, and often have more extensive mucous membrane involvement. The rash in Rocky Mountain spotted fever begins as erythematous macules and papules but typically starts distally, hands and feet, and becomes purpuric as it progresses. Laboratory and biopsy. Routine laboratory tests are of no help. Usually, no tests are ordered, however, serologic tests can confirm the diagnosis by detecting a rise in antibody titer in convalescent compared with acute serum samples. Viral cultures are available but are not often obtained. A skin biopsy is not indicated. Histologic examination usually shows a nonspecific lymphocytic perivascular infiltrate. In measles, the infection also involves the epidermal cells, resulting in intranuclear inclusions, multinucleated giant cells, and individual cell necrosis. Therapy. Treatment of acute disease is symptomatic. Measles, mumps, and rubella can be prevented through vaccination with a combined attenuated live virus vaccine, MMR, administered in 2 doses. Therapy for viral exanthems. Initial. Antipyretics and analgesics, acetaminophen or ibuprofen. Hydration. Vaccine. Course and complications. Spontaneous, complete resolution usually occurs over several days to a week. Systemic complications are uncommon. Encephalitis is the most serious, occurring in patients with measles at a rate of approximately 1 in 1,000. It results in death in 10% to 20% of affected patients. The rate is much higher in some developing countries, where encephalitis remains a leading cause of death in children. Worldwide, measles continues to cause about 1 million deaths per year among children younger than 5 years of age. Note, encephalitis is the most serious complication of measles. Rubella and Erythema infectiosum are frequently complicated by arthritis in adults. Infection with Parvovirus B19 has also been associated with acute aplastic crises in patients with a history of chronic hemolytic anemia, such as sickle cell disease. The most important complication of rubella is congenital rubella syndrome, which occurs in babies born to mothers who were infected during the first trimester of pregnancy. With rubella vaccination in widespread use, this condition is rare. Herpes virus type 6 is a major precipitant of febrile seizures in infants. Pathogenesis. In all the viral exanthems, the virus gains entry through the upper respiratory, example, rubella and rubeola, or gastrointestinal, enteroviruses. Route, incubates silently for a period of days to weeks, and then enters a viremic phase that causes the febrile prodrome and results in the dissemination of viruses to other tissues, including the skin.
Clinical case. A 7-year-old boy presents with a 3-day history of low-grade fever, headache, malaise, and mild rhinorrhea. 2 days after the fever subsided, his parents noticed bright red erythema over both cheeks, giving a characteristic slap cheek appearance. 1 day later, a faint, lacy reticular erythematous rash developed on his trunk and extremities. He is otherwise well, with no mucosal involvement, lymphadenopathy, or significant pruritus. His mother reports that several children at his school recently had a similar mild illness. What is the most likely diagnosis? A. Drug eruption. B. Toxic erythema. C. Rocky Mountain spotted fever. D. Erythema infectiosum, 5th disease. E. Scarlet fever. Correct answer, D. Erythema infectiosum, 5th disease. Key clue, The combination of a mild prodrome followed by slapped cheek facial erythema and a lacy reticular body rash is classic for Parvovirus B19 infection. Why the other options are less likely? A drug eruption usually presents as a generalized symmetric maculopapular, morbilliform eruption, often beginning on the trunk and spreading to the extremities. A clear history of a new medication is usually present. The classic slapped cheek appearance followed by a lacy rash strongly favors Erythema infectiosum. B. Toxic erythema. Toxic erythema is a broad term and can refer to several reactive erythematous eruptions. These conditions generally do not produce the characteristic sequence of slapped cheeks reticular, lacy eruption seen in Parvovirus B19 infection. See Rocky Mountain spotted fever, RMSF, caused by Rickettsia rickettsii and typically presents with fever, severe headache, myalgia, and a petechial, maculopapular rash that classically begins on the wrists and ankles and may spread centrally, including the palms and soles. A history of tick exposure may be present. The patient in this case lacks these features. Scarlet fever, caused by group A streptococcus, usually associated with pharyngitis, fever, strawberry tongue, and tender cervical lymphadenopathy. The rash is typically a fine, blanching sandpaper eruption, especially on the trunk and flexures, rather than a lacy reticular eruption.